Assalamu alaikum. I'm Dr. Mohsin Mighiana and I'm speaking from my own YouTube channel to you. And today the purpose of talking to you is my 24th book has been published, which is Making of a Chief Surgeon. Making of a Chief Surgeon. I have retired as a Chief Surgeon on 1st January 2016. Actually, the purpose of writing this book was how I became doctor and how I choose to become a surgeon. How Allah guided me to become a doctor. How He introduced to me the pain of the patient and how all the changes I have seen while I graduated in 1981. You will be surprised that in 1981 there was no ultrasonography, no ultrasound available in Pakistan. This is amazing news for some of you, but this is the fact. But we actually, doctors of that era, they were more concentrating on the patient, symptom of the patient, and try to diagnose without investigation or the investigation available at that time. In that era, you will also be surprised that ether was also used as anesthetic agent, you can say. And the people, the dispenser used to put a mask on the face of the patient, mouth of the patient, and then put ether on it. And the patient post-operatively could not awake for about 2 or 3 days. He could not, definitely when he was not awake, he could not get even liquids, and he was continuously on drips. So there are so many changes in the surgical world especially, which we have witnessed. The group of doctors in 1981 and around, we have witnessed so many changes, which I think as a writer, I felt my duty to write all those changes. What to talk of CT scan and MRI when ultrasound was not available. Even if we want to do a cholecystectomy to remove a gallbladder, we have to do oral cholecystogram, for which we have to prepare the patient in the evening, give 9 tablets of Talipac, and then in the early morning we're having an X-ray, and then we will give fatty meal, and then it contracted, the gallbladder contracted, and then we see the image whether it is not properly contracted or. So this was the time. And you know, now these bougies they're known as sound. Why they are known as sound? Because as there was no ultrasound, and some of these stones, they are radiolucent, they don't come on the X-rays, and that's why that bougie was put into the urethra, and there was, when it struck the stone, there was a sound. So that's why it is called sound. So I have recorded rather for the next generation that how many changes have been appeared in. You can imagine when I worked in Orthopaedic as a surgeon, I worked in Chandigarh as a surgeon, and no anesthetist was available at that time there. If I want to escape, I could have said that I will not do surgery because there is no anesthetist available. But I gave anesthesia myself, both in tenute and both in the overtaxing, and still I did so many surgeries. I'm also thankful to the patients, attendants, press, and all the people who got confidence in me, because I became a doctor, I became a surgeon to serve the humanity. Otherwise, I could have easily said, but no, there's no anesthetist, so I will not work as a, so I could just have an outdoor and then do my private surgery. No. Fear of God should be there. The fear of God should be there. So this book is dedicated making of a chief surgeon. As I have retired as a chief surgeon in grade 21, that's why its name is Making of a Chief Surgeon. Now this book is dedicated to my son, Dr. Mohsin. Dr. Mohsin, my son graduated from SIMS, Lahore, and later he got F.I.C.S in general surgery, and then F.I.C.S after working in Shaukat Khana, he did F.I.C.S in surgical oncology, and later he got the fellowship of the whole Europe for this surgical oncology, and he is working as assistant professor in F.I.C.S Medical College, but he is doing all the laparoscopic cancer surgery. Alhamdulillah, Alhamdulillah. My other daughter is in America, Dr. Mohsin, and she is doing working in internal medicine there. There's a town near Boston that is called Pittsfield there, and my younger daughter Malaika Mohsin, well, she is doing psychology. So the purpose of writing this book is to write a history, which I think may not be, some other person may not write it. So I thought it is my responsibility as I can write. Now I'm also thankful to the Sangli publications, Dr. Mohsin Mighiana, who will beautifully published this book. And I must also say, I have written 6 poems in English, which are included in this book at the end of it. CV is also, my CV is also there. No, it's preface. The comments about this book has been written by 4 of my friends, you can say. Mushtaq Sufi is a big name. He is a columnist in Dawn, and moreover, he is a Punjabi writer also. And as I'm also a member of Pakistan Punjabi Advi Board, he is our president of Pakistan Punjabi Advi Board. So he writes column in the Dawn, and the first his comments I will read. His Making of a Chief Surgeon is a fascinating story of his long journey as a medical student and a practitioner. What could be unusual about it? Unusual is the relentless struggle of a young man to be highly trained professional from an underdeveloped area where superstition is taken as knowledge rather than science, and feudal sluggishness is valued rather than hard work. He is talking about Jhang, because I belong to Jhang. The story begins when he himself, while studying F.I.C., suffered from excruciating pain and was taken to hospital in a horse-drawn cart, that's Tonga, and experienced the pain and the misery of the helpless patient, which is the representative of the plight of the millions and millions of people in our homeland. The story doesn't merely epitomize his firm resolve to join and shine in the medical profession, but also reflects the economic problems and social and cultural habits of his fellow travelers. He is a story of human interest that delineates some important facets of life in peri-urban area, sandwiched between a frozen past and the fast thinking, fast changing present. Now, what a beautiful sentence, that between frozen past and the fast changing present. That's how Mushtaq Sufi writes. Now, Professor Sajid Sheikh, he was my student, and now he is a big surgeon, professor of surgery in PMC and Faisalabad Medical University, and he writes about this book. I first had the pleasure of meeting the amazing, famous for his beautiful smile, Mohsin Bhai, in 1983. Even my students used to call me Mohsin Bhai. I was so frank with them. He taught me anatomy during first year M.B.B.S. I didn't know a person could be so many things at once. A remarkable teacher, a mentor that I could proudly look up to, and most importantly, a loving elder brother. Not to forget how handsome, well-dressed and well-groomed Mohsin Bhai was, and ruled every heart like a magnificent king. That's Professor Sajid Sheikh, a very popular surgeon in Faisalabad. And next comments are from Mohsin Mighiana. He is my cousin. He is very good artist, and he is head of department, English department in Farhan College, Jhang. The book in your hands is an arresting chronicle of a medical student's journey towards a great surgeon. I would daringly recommend this book to every student. The comments from Sidra Arsalan. She is a lecturer in English and SOAS, Jhang. She writes, here in this book, readers can get first-hand experience of a doctor in making and later a surgeon. Not only a surgeon, but a successful, brave, empathetic, and God-fearing surgeon who is different from the public opinion about doctors. Thanks all for these such a healthy comments, and this has raised my morale, and I have established one unit here, and there are so many things I have also done as a social work also for the patients, and this book is must-read book, especially for the medical students and especially for the doctors, and more especially for the surgeon, making of a surgeon. And I'm very glad that I have had a little contribution towards the history of surgery. Now at the end, I thank my producer, Rajavali. Thank you very much.